Hey guys, this is Dr. Hub. Today we'll look at the WHO. This is the grading, WHO grading, and it is going to be of the vitamin A deficiency. So to begin with, it is known as the xerophthalmia. So here this xerophthalmia, it is reserved to cover all the ocular manifestations of the vitamin A deficiency. So first we are looking at the XN. So these are the stages. So when you look at the XN stage, this includes the presence of the XN stands for the night, N for the night. So there is night blindness. Next is, as we move on, we look at the pathophysiology. What is the pathophysiology of this? This is due to the lack. There's lack of the rhodopsin. Then comes the X1A. X1A, it means there is conjunctival xerosis, and this pathophysiology is that there is a conjunctival epithelial alteration, and there is also loss of goblet. There is loss of the goblet cells. Next is we have the X1B. So X1B is nothing but there is a Bitot spots. So Bitot spots is nothing but there is a conjunctival epithelial alteration. There is a conjunctival epithelial alteration, as well as there is loss of goblet cells. There is loss of goblet cells. So it's similar to that of the conjunctival xerosis. So loss of goblet cells. Next we are going to move on to the X2. So what is meant by stage X2? So this means there is a corneal xerosis. So here it is the corneal epithelial alteration. So there is a corneal epithelial alteration. Then move on to the X3A. So what happens in case of X3A? So in terms of X3A, there is a corneal ulceration. There can be corneal ulceration, and there is also the keratomalacia, this corneal ulceration, as well as keratomalacia. So what this does is it affects less than 1/3. So it affects less than 1/3, and this is of the corneal surface. Less than 1/3 of the corneal surface. So what is the pathophysiology here? It is that there is liquefaction of the corneal stroma. There is liquefaction of the corneal stroma. Then we move on to the X3B. So X3B, it is basically again the corneal ulceration, and there is keratomalacia, and here it affects greater than 1/3 of the corneal surface. Next we look at the XS. So this, it refers to the corneal scar. Next, looking at the XF, it is the xerophthalmic fundus. And what is the reason behind this pathophysiology? Is that there is degeneration of the retinal pigment epithelium. So now we'll look at the symptom. So first symptom will be of the xerophthalmia. First symptom of the xerophthalmia is nothing but the nyctalopia. After nyctalopia, the next sign. So next is the first sign. The first sign of the xerophthalmia, it is a conjunctival xerosis. It is nothing but the conjunctival xerosis. So first symptom is the nyctalopia. First sign is going to be the conjunctival xerosis. Next is there is going to be a pathognomic feature. So feature of the xerophthalmia. So it is nothing but the appearance of the Bitot spots. So this was all about the vitamin A deficiency and its WHO grading. To learn and grow daily like this, please do subscribe.